So do you think that by actually doing sports, being sports oriented yourself has helped you as a physician? I mean, does it, it's sort of like the person who says, well, what do you know about it because you don't do this? And you can say, well, yeah, I am sports active and this is what I do. And have you found that as, doing these different sports, it's given you insights as a surgeon?
Yes, for sure. You can speak the language, you have the vernacular that you really can understand where they're coming from, and you're able to really to relate to them. And especially in the field, my field, in surgery, once you've had a surgery, I think that you can relate to patients a lot more easily as well and say, hey, this is going to be fine. You're going to get taken care of. We are going to get you through this and really get you back to the whatever sport you love. And you tell them a little bit about your experience and how you've been able to do that. But also being on the field with them, I think you really get to understand sort of where they are. You get to understand, what positions they love to do. You get to talk to the coaches. You get to talk to the trainers. You really see, sort of how much that sport is so important for that particular patient. And that allows you to really engender yourself to the patient and the patient to you as well, because you're there with them and they understand that this is something that you really are invested in. You want to be with them on the sideline, even though, injuries don't happen very frequently, but you're a part of the team. You're the team doctor, you're the team physician. You get to take care of them through, the good times when they're winning, or the bad times when they're losing, or they might have an injury that might keep them off of the field. So I really think that allows us to really help us understand our patients in a much better way. And they understand that. They say, hey, Doc's done this before. He understands this. He's going to get it. He's going to be able to help me through these particular stages, whether it be surgery, whether it be rehab, whether it be an injection, whether it be medications.
What does it take, in your opinion, to succeed in a sport?
Initially, I think that there is a certain level of willingness to listen, and take the advice of whether it be a coach, whether it be the physical therapist, whether it be the trainer. So there's a little bit of humility that's involved with that. But really, when it all boils down to, it's just dedication, that they are dedicated to whatever they do. And the athletes that I've seen really succeed, they understand that I was a great athlete, I injured myself, and now I need to focus on my injury, and everything else, will take care of itself down the road. So they're dedicated to therapy, they're dedicated to getting their motion, they're dedicated to getting their strength back, they're dedicated to whatever the case may be that the trainers or the physical therapist or myself are telling them. So I think that dedication is probably the biggest thing that I can instill, and really that they want to get back, and they're willing to do anything that they have to do that's necessary in order to get that injury taken care of.
Among the most dedicated athletes I know are fencers, and we've invited Dr. Slabaugh to visit a local fencing SAL or club, in this particular case, the Chesapeake Fencing Club in Towson, for some hands-on sports medicine insights. I want you to think I'm going to come forward when I'm really going backward and vice versa. So I want to get you coming forward when you think I'm about to go backwards, so you'll walk into my blade. So footwork is just so essential. The hand is important.
Yeah.
You don't want to grip this too hard like it's a club, because if you're gripping it hard, you can't make small movements. You want your movements to be really tiny. So I'm actually fencing someone. I'm trying to see what are they susceptible to. So for example, if I'm coming forward and I put out a faint line, do I see a big parry reaction?
We do 3 to 5 minutes worth of warm-up before we try to do any lunging at all. Because a lunge essentially is a ballistic stretch. Really, it comes down to it. You are throwing yourself onto that front leg. To be doing the lunge, you need to be lunging on warm muscles. So always 3 to 5 minutes worth of warm-up before you start trying to lunge.
How do you guys prevent any injuries in fencing?
It's getting increasingly more difficult.
Yeah.
At this point, we're tending to have injuries that are more related to aging than they are to fencing per se. 4 years ago in the fall, almost to the day, it was a tournament, and I think another fencer may have sort of bumped into me, And as I sort of lost my balance a little bit, a little pain in my right knee. So that would be the back knee. It's very common that it's the back knee that the fencer's injured. It took me a long time to recover from that. It was probably a meniscus tear and maybe a little MCL.
In the professional world of fencing, if somebody injures themselves, how often does that end their career?
For the most part, the fencers that we've had have had to leave the sport because they've gotten injured in other sports.
Oh, okay, yeah.
We had, for example, I had a young lady who's a volleyball player. Well, playing volleyball, she dislocated her shoulder.
The injuries that take the professional level athletes out of fencing just for a short period of time. And how long are they typically out?
Yes, well, my son in particular, he's maybe not professional level yet, but he's a college fencer. But when he was still in high school, he'd had a habit of gripping his weapon too tight. He developed the pinched nerve in his forearm.
Yeah.
So he was out for a good long while they did physical therapy for that.
Yeah.
Got things loosened up, and so it cost him it cost him probably his most important season when they
were recruiting him.
They would have been recruiting.
Yeah. No, I can imagine just from looking at fencing and seeing what you guys do that I'm sure that tendonitis and sprains are probably the most significant injuries that you guys would have.
Yep, I think you're right about that. I've certainly had my share of those.
Yeah. Anything that involves overusing, certain muscle groups for an extended period of time definitely gives you a disadvantage for tendonitis. And I completely agree that stretching your students out at the beginning is the most important thing you can do.
Many thanks to everyone at the Chesapeake Fencing Club for participating in today's program. We'll take one last break and then we'll return to the studio.
The Orthopedic Specialty Hospital. Dr. Mark Hungerford leads Mercy's joint replacement team, among the first in the state with robotic-assisted knee replacement. Home of the Maryland Spine Center, an expert team treating spine injuries and disorders. The Institute for Foot and Ankle Reconstruction, pioneering innovative treatments. Mercy offers programs for shoulder, elbow, hand surgery, and interventional pain. And sports medicine serving athletes, active adults, and parents cheering on the sidelines. Orthopedics at Mercy.
And we're back for our final segment. During the break, Dr. Slabaugh was telling us about different sports, including one wouldn't think too much about as a way to burn calories or stay in shape, and that is chess. Can you tell us a little bit about that?
Yeah, I just recently read a very stimulating article that talked about grandmasters in chess and how many calories they burn per hour while they're in their competition. Something you never would have thought about. You don't think that chess, you're just sitting down and you're using your mental powers, trying to sort of think 10 steps ahead, so to speak. But they burn a significant number of calories, more than you would expect during their matches. And now they're starting to have exercise routines for chess grandmasters to make sure that they've got the aerobic capability to be able to sustain that, which helps their mental capabilities as well during their matches, and lifting exercises or routines or regimens so that they really can do that, because they have talked to some of the chess grandmasters and they really feel like they're sort of stressed during that, and so they're contracting the muscles that you just wouldn't expect to be contracted during just sitting around.
Now, I'm going to guess you've never actually treated a chest injury, though.
I have not treated a chest injury. Sort of a tongue twister there.
Now, it's been said that seeing is believing, that a picture is worth 1,000 words. The internet is soon going to be more than 90% video, so people like things that are visual. And to that end, a regular feature of Medoscopy harkens back to our school days of show and tell. Dr. Slabaugh, I believe you brought something with you to share with us today.
I have. So just like we talked about before, I was at the Air Force Academy for 5 years where I was the chief of sports medicine and got to work with the football teams, basketball teams, men and women, and also baseball teams. And one of the things that really engendered me to my time there was just the camaraderie, like I spoke about. You're seeing training room 2-3 times a week, and really going and doing a lot more just sort of outside of your normal clinic hours, what you would expect for a normal physician to do, to be with the team, to be on the practice fields, to be with them on the sidelines. And so the item that I chose is just a football helmet, and it also has some meaning for me as the Air Force as well. If people are familiar with the A-10, the Warthog, this is sort of the helmet is related to the emblem or the symbol that's on the side of a Warthog, or the A-10, which is basically an air-to-ground fighter plane in the military. And the Air Force Academy every 2 years comes out with their legacy helmets that sort of are a tribute the different specialties in the Air Force, and they just happened to have this one of the years that I was the head team physician for the Air Force Academy. And it's sort of a tribute to the men and women who really defend our country, and that's why they had this particular helmet. So I have this at home, and it's just one of those things that makes me realize that there's so many people out there that are really dedicating their lives to supporting this country and defending the freedoms that we love, that allow me to be a surgeon, to be able to treat patients, and allow us to be involved in sports. And I really, my hat goes off to those men and women who are in the United States Air Force and any of the armed forces, because they truly are the embodiment of what I view as the beauty of the country that we live in. And they're really people that are giving their all for us, and my sacrifices are minuscule compared to what they've done. So this is just sort of a tribute to both sports medicine and also the men and women of the United States Air Force.
Can't help it because I'm a baseball fan, so I have to ask. I've been following baseball since the 70s. It seems to me we're seeing, particularly among pitchers, much more issues and problems injury-wise than we did back in the 70s and 80s and even in the early 90s. And now, of course, as you're probably aware, most major league pitchers, if they go 5 innings, that's considered, wow, that's great. As a sports medicine person, as a surgeon, what do you think is the cause for that?
I think that it's a lot more recognition that it's not necessarily that the pitchers can't pitch like Jim Palmer did in the past, but that we understand that the more pitches you throw, especially with higher velocity or with more curveballs, and certain pitches put you at an increased risk for injuring your ulnar collateral ligament, so it's called this Tommy John ligament that pitchers injure very frequently. So there's a lot of more realization that if we can save them and sort of decrease their pitch count, then hopefully they don't get these injuries in the first place.
Thank you, Dr. Slabaugh, for your time and your candor. I'm hoping our viewers enjoyed an opportunity to get a bit more up close and personal with you, and hopefully learned a little something they can apply to their own lives. And thank you for watching. On behalf of myself, Dr. Mark Slabaugh, today's special guests, the Chesapeake Fencing Club in Towson, the Mercy staff, and the Sisters of Mercy, we wish you good health and humor. Until we meet again, may the road rise up to meet you. We'd like to conclude every episode of Medoscopy with what we call the one more thing portion of the episode. And in this particular case, just something to thank you for helping us out. You mentioned your time in Germany playing sports, so we wanted to pass this on to you.
Thank you very much. I appreciate that very much.
So,
thank you, Dan.
Thank you, and thanks Dr. Mark Slabaugh, Ray Gordon of the Chesapeake Fencing Club, everyone here at CFC, and all our viewers for watching.